High blood pressure or hypertension, it's one of the most common health issues out there. And to treat it, doctors often turn to two very common diuretics, hydrochlorothiazide and chlorthalidone. Now, they're both considered cornerstones of treatment, but they are definitely not the same.
So here's the thing. In the US, one of these pills is used way more often than the other. But does being popular mean it's actually better? And that's the big question we're going to dig into right now. So first things first, let's set the stage. Why should you even care about this? Well, because high blood pressure isn't some rare niche problem. For a whole lot of us, it's not a question of if we'll get it, but when.
Just get a load of this number from the super famous Framingham Heart Study. 90%. 90% of people who have totally normal blood pressure at age 55 will still end up with hypertension at some point. I mean, that's almost everyone.
And as you'd probably guess, the odds just keep going up as we get older. Once you hit age 60, about 60% of people have it. Fast forward to age 70, and boom, it jumps to roughly 2/3 of men and an incredible 3/4 of all women. This isn't just a number on a chart, right? This is a massive public health reality.
Okay, so we've got this huge, widespread problem. What are the solutions? Well, let's meet the two main characters in our story today.
All right, in this corner, we've got hydrochlorothiazide. We'll just call it HCTZ. This is the undisputed champion, the most prescribed diuretic in the entire US. And in the other corner, we have chlorthalidone. It's not prescribed as much, but here's the twist. It's the one used in a lot of major clinical trials, and it has a reputation for being way more potent. So what exactly do these things do? They're both what we call thiazide or thiazide-like diuretics. The easiest way to think about it is that they basically tell your kidneys, hey, let's get rid of some of this extra salt and water. When you have less fluid hanging around in your blood vessels, there's less pressure on the walls. It's simple, it's elegant, and it's really effective. All right, now for the main event. How do these two actually stack up against each other? Let's put them head to head and look at what really matters. Okay, so let's get into the nitty-gritty, the technical specs. If you look at the top when they start working, how long till they peak, pretty similar. But look down at the bottom two rows, duration and half-life. The difference here is huge, and this is where things get really interesting. To make it super simple, think of it like this. Chlorthalidone is the marathon runner. It gets in your system and just keeps going and going for up to 72 hours. HTCZ, on the other hand, is a sprinter. Its effects last maybe 6 to 12 hours. And that longer duration for chlorthalidone is a big deal. It means if you happen to miss a dose, it's not as big of a problem. There's less of a rebound. Okay, so what about pure raw power? Well, one study compared them, and the results are pretty wild. Chlorthalidone at just half the dose, 25 milligrams, brought blood pressure down by an average of 12.4 points. Meanwhile, HCTZ at double that dose, 50 milligrams, only got it down by 7.4 points. So yeah, it's pretty clear that chlorthalidone is a lot more potent. And it's not just one study. Bigger analyses have backed this up, which has led to a really simple rule of thumb for doctors. 12.5 milligrams of chlorthalidone has about the same firepower as 25 milligrams of HCTZ. It's basically twice as strong milligram for milligram.
But you know what they say, with great power comes, well, potential side effects. Both of them can cause issues like low potassium or low sodium, make you more sensitive to the sun, or even kick off a nasty gout attack. And there's some evidence that because chlorthalidone is so much stronger, these kinds of metabolic side effects might be a little more common when you take it.
All right, now we have to talk about something that's absolutely critical, and that's how these drugs play with others. Because let's be real, almost nobody is taking just one medication these days.
So what happens when you throw a common painkiller, something you can just buy over the counter, into the mix? Well, the results can range from, oh, that's not working so well anymore, to, wow, this is actually dangerous.
Let's kick things off with something pretty much all of us have at home, NSAIDs. That's your non-steroidal anti-inflammatory drugs, things like Ibuprofen. It turns out studies show these common painkillers can actually work against the diuretics. They basically blunt the effect, which means your blood pressure medicine isn't working as well as it should. That's a really important interaction for everyone to know about. Okay, now for a much, much more serious interaction. Let's talk about lithium. It's a medication used to stabilize mood, and it has what doctors call a narrow therapeutic window. What that means is the line between a dose that helps you and a dose that's toxic is incredibly thin. And believe me, lithium toxicity is a full-blown medical emergency. We're talking seizures, coma, and even death.
So, where do our blood pressure pills fit into this scary picture? Well, here's what happens. When you add a thiazide diuretic, your body starts flushing out more sodium. Your kidneys sense this, and they try to compensate by grabbing back more sodium from your urine. But here's the dangerous part. Your kidneys aren't great at telling the difference between a sodium ion and a lithium ion. So as they're desperately trying to pull back sodium, they accidentally pull back a ton of lithium too. And just like that, the lithium levels in your blood can shoot up into the toxic range. Okay, wow. So we've looked at how strong they are, how long they last, the side effects, and these really serious interactions. So, after all that, which one is better? Well, like a lot of things in medicine, the real answer is it's complicated. And this right here is probably the most important point of all, and it's a direct quote from the research. Even with all those differences we just talked about, no study has conclusively shown either drug to be better in preventing adverse clinical outcomes, things like heart attacks or strokes.
So what it all boils down to is a personalized choice, weighing the pros and cons for each individual person. For example, a doctor might go with HCTZ for someone who's a bit more sensitive to those metabolic side effects we mentioned. But for another patient, they might pick Chlorthalidone because it's so much more powerful, and that super long duration acts like a great safety net if someone accidentally misses a dose.
So look, the big takeaway isn't about finding a winner or a loser. It's a trade-off, right? Chlorthalidone is stronger and lasts longer. HCTZ might have a slightly lower risk for some of those side effects. The best pill is the one that's right for you, and that's a decision you can only make by having a real conversation with your healthcare provider.
And that just leaves us with one last thing to think about. We started this by saying that HCTZ is by far the most popular choice in the US. But as we've just seen, being popular doesn't mean it's more effective. It really makes you wonder, doesn't it? When it comes to your health, is the most common choice always the right choice?